Come in. Please have a seat. Hi, good morning, Ken.
Hi.
My name is Dr. Gregor.
Hi, nice to meet you.
Please have a seat.
Okay.
We start with bringing a book. So Ken, tell me more about what brought you here to visit me.
I've been having panic attacks for for a very long time, like about 15 years.
Okay.
So it's starting to affect me, and I thought maybe I should come in to see someone. Yeah.
Okay. Tell me about your most recent panic attack.
Okay. Wow. This one was bad. Okay. I was driving my kids to school, and I had my wife with me, right? So, I was just driving, and it just suddenly hit me, right? I remembered my kids like making a lot of noise, and I was telling them to like just shut up and just let me drive in peace, but
Okay.
yeah, they just wouldn't stop. So and all of a sudden it just hit me. I started like my heart started racing. I had could feel my heart, had heart palpitations, and my palms started getting sweaty, and like I couldn't grip the steering wheel properly. I thought I was gonna crash, and then like I just got so dizzy, and suddenly like felt like it felt so surreal, like I really wasn't there, or like yeah,
Okay.
so yeah, I just stopped the car, and I had to compose myself before I drive. I was so afraid that I would just crash into another car and everything.
Okay. Yeah, that must have been a very scary experience for you.
Oh yeah.
What did you do to cope with it at that time?
Okay. I stopped the car, and I got out, and like I just started using some breathing techniques that I picked up, and it helped me, and after about 5-10 minutes I was okay, and my wife continued driving, and yeah.
Okay. How has this incident affected your life in any way?
Yeah, I've it happens quite a lot. So yeah, every time when I'm doing something, all I'm worrying about is when is it gonna hit me, and whether it's gonna come at all, and like how am I gonna am I even gonna survive it? Like sometimes if I'm driving, what if I crash, and what if I die, right? And yeah, sometimes my heart is racing so fast that I think that I'm gonna die of a heart attack or something. Yeah, so it's been quite hard on family life, and sometimes even work.
Ken, before that, could I get you to tell me more about yourself and about your family?
Well, what do you want to know?
Well, tell me about maybe your age and what are you doing now?
Okay, I am 45. I'm married with 2 kids, and I work as a school principal.
Hi. Okay, good morning, Ken. So how have you been in the past week since our last meeting?
I've been good, Dr. Gregor. So, how have you been?
Oh, I'm good.
That's excellent. Yeah.
Okay, so let's pick up from where we left off the last session.
Okay.
Okay, so tell me more about when do you have your first ever panic attack?
Wow. This was quite a number of years ago. I think it was about maybe 15 years ago.
Okay.
Yeah. So I remember I went out for drinks with some friends, and I got back around 1 o'clock, and I fell asleep in my living room. Yeah. So what happened was I suddenly woke up at around 4 or 5, and I just started my heart just started beating very quick, and then I thought something serious was going to happen. So I jumped up, and I started feeling dizzy, and I thought I was going to faint or have a heart attack or something like that.
Okay.
Yeah. So I went out and got some fresh air, and tried to help the situation, but it didn't work until like I think but all that just went away after some time. So it was actually the first time that all happened.
Alright, so ever since that first incident, how has things been for you?
Oh, wow. Now these panic attacks come about, a few times a month, and every time I'm just worrying about it, and yeah, I just don't feel good whenever I'm doing things.
Okay. Will you say that your condition has gotten better or gotten worse since that first panic attack?
Well, it actually worsened. I remember when the most drastic situation was when I moved from where I was in, and I moved to New York, and I got a new job, and then I remember the frequency of these attacks just increased. I started getting almost one a week, and yeah, it was difficult, especially when I was dealing with a new job and just a whole new environment.
Okay. How were you feeling during this transition when you moved to New York to get a new job?
Well, I guess the whole time it was just it was a very big thing for our family, because it's a big move.
Okay.
We moved from a little town to a big city, and yeah, so I suppose that that might have made things, like, made me a lot more stressed and all that.
So during that period, was there anything that was happening in your family as well?
Oh, during that time, I think it was a arrival of my son. Yeah, he was just, we moved like just a couple of months after he was born. So things, it was my first child, and things were just just still getting a hang of being a parent and everything.
Right, a really hectic time for you.
Yeah, definitely.
Okay. So I would like you to tell me more about a typical panic attack that happens to you. So basically, what do you experience?
So usually what happens is, I'll start, like, I think I mentioned this before, like my palms get sweaty. Yeah, I'll get dizzy, my heart will beat very fast, and sometimes it gets so bad, right, and overwhelming that I might even fall to the floor and just I have to sit down, or yeah, just to let it pass and everything. Yeah, I think it might have helped, just sitting there, and yeah.
Okay. So often when you feel like you're about to faint, you think sitting down would actually help you feel better?
Yeah, it does most of the time.
Okay.
Yeah.
Well, Ken, basically sometimes psychological disorders might be hereditary. So
Yeah.
I'd like to ask you to think back on your family history. Has there been any history of mental illnesses in your family?
Well, I think my mom suffers from the same thing. I didn't know that was the case, and all along I thought she was just like someone who's like really anxious, and it's just like a personality thing. But after I learned more about what I was suffering from, I realized that yeah, she also suffered from panic attacks, and
Okay.
yeah, and
Is there anyone else in your family besides your mom?
oh yeah, well, mostly all on my mother's side. I think she has a sister who also suffers from this, and my grandmother, which is her mom, like, was also and she was an alcoholic, and she also had like such panic attacks and disorder, and this disorder. Yeah, so yeah, basically it runs in the family.
Oh, okay.
Yeah.
Right. Just now you mentioned about some alcoholism being run in the family. Are you also experiencing anything to do with alcoholism?
Well, I used to be a very big, I used to drink a lot.
Oh,
Yeah.
okay.
I remember one of the darkest periods of my life, like when these panic attacks like started affecting me a lot. Yeah, I started drinking thinking that like this will help the problem. Yeah, but no, it didn't really work. Yeah. but the thing is, yeah, I stopped drinking now. Yeah, it's been a while, like 6 or 7 years.
Okay, how do you actually get over that period of the bout of alcoholism?
Well, I actually went for some therapy, and yeah, it worked, and yeah, I stopped drinking, and yeah, basically it was effective.
How long has it been since you've gotten over your problem with alcoholism?
I think about close to 7 years already. Yeah.
Right. Can I'll also like to ask you about your past medical history.
Okay.
Well, in the years building up to this period when you're facing these problems with panic attacks,
Yeah.
did you seek any medical treatment?
Oh, yeah, I did. I actually went to a psychiatrist once, and I described him my problem, and he prescribed some Valium to me. Oh wait, no, that was my GP.
Oh, okay.
Yeah, okay, yeah.
Right,
So my GP thought they gave me some Valium to help me like ease the symptoms, but I didn't fill out the prescription. I never took the Valium because yeah, it just didn't, like it didn't make sense because like yeah, I wasn't suffering from it at the time, like
Okay.
you know what I mean, like
Yeah.
sometimes when it comes and goes. Yeah, I had a time where I had to fill out the prescription. This anxiety attacks didn't affect me, so I thought, things were fine.
Okay.
And I didn't fill it out, but the thing is, yeah, about a month or two later, I had another panic attack, and it just continued.
Sure.
Yeah.
Okay. So besides this GP that you first visited, have you been in other forms of treatment?
Yeah, I actually sought help from, what I mentioned earlier, a psychiatrist. I think he prescribed some benzos to me. It was Xanax or something along the lines.
Oh,
I
right,
can't
Xanax.
remember. Yeah, that's right. And I also sought help from some medical social work.
Okay.
And went through some therapy, but well, it helped me understand what I was suffering from, and like it just eased a lot of the fears that I was having, especially like I was always worrying that I was gonna die of a heart attack, and so I started to understand that it's actually a panic disorder rather than a heart condition. Yeah, and it's also confirmed by my GP that I have a clean bill of health, and yeah, my heart's perfectly fine. So yeah, that really helped a lot of the anxiety and the stress. Yeah.
Okay. Okay, Ken, so thank you for sharing with me
Alright.
about your history and some of the things leading up to this incident. So I'll actually be introducing you to some new forms of treatment.
Okay.